Well, we're back with Clear Vision today, and Dr. Param Fagoora, who is one of the foremost eye surgeons here in Fresno, California. We're talking about your children today, the things that you need to impress upon your children and your grandchildren about their eyes and their eye health. And I want to turn Dr. Fagoora loose to discuss that.
The children eye health is a very important topic because children can live longer and we need to prevent the eye problems or eye diseases at an earlier age. The eye vision is so unique that it takes the first 5 years of child's life to form all the components of good vision, including the depth perception and color perception. The eyes have to have a clear picture in each eye, same shape, same size, same color to form the depth perception. If any of these elements is lacking, it will not allow the depth perception development or will lead also to a condition called amblyopia. Now, before we talk about the condition that cause amblyopia, we need to talk about two conditions or three conditions that are very important to be diagnosed at a very early stage. The first one is the congenital cataract. Now, in congenital cataract, the light cannot go through the eye, one eye or both eyes. If one eye is affected, the child will be very deeply amblyopic. So for that reason, the parents need to make sure the child can see with each eye, focus on the toys, and also sometimes the eyes start wandering or like shaking movement of the eyes called nystagmus. If nystagmus is detected in the first 2 months of life, it's recommended that you see the pediatrician right away and ask him if the child is able to see with each eye. If the pediatrician cannot determine, he will advise refer to the ophthalmologist, which is important because the congenital cataract need to be fixed in the first 2 weeks, for first 8 weeks of life. Otherwise, child will suffer a permanent amblyopic vision or vision will be very bad in the affected eye. There are good advancements in treating congenital cataracts these days, and that is a good, helpful modality to help the children. The second condition that a child can develop early on is called congenital glaucoma. Congenital glaucoma, the eyeball, due to the high pressure in the eye, starts enlarging, and the child will start tearing in that affected eye, or both are affected, then tearing or watering in both eyes when avoid the sunlight. So if the child has these symptoms of tearing and sunlight sensitivity in the larger eyeball, please again see the pediatrician and ask him if the child has something wrong with the eyes. The third condition that comes to my mind is the droopy lid. Droopy lid is also called ptosis. If the droopy lid is down to the level that the child cannot see with that affected eye, that need to be corrected earlier because that is again not allowing the eye to be seen. So if the child has a droopy lid and the child need to be seen by a pediatrician, and he will advise that an ophthalmologist should be seen. Now the other symptoms, if the child has constant rubbing of the eyes, and that could be a sign that need to be seen because we need to rule out why the child is rubbing the eyes. It could be allergy, or it could be other conditions we can discuss like corneal infection or conjunctival infection, and they need to be treated fast, but we do not want anything affecting the cornea that can cause effect on the child's vision. If the child sits near the TV or near the cell phone, or doesn't want to go to the school because he cannot see and learn, and the teacher tells the parent that the child cannot see well and I have to move them to the front seat, That's the sign that the child need to be seen so that the vision can be corrected and he will be happy. Now, we as ophthalmologists and eye practitioners seeing a big surge in the children developing myopia or astigmatism. The thinking right now is that the heavy use of the cell phones, video games is contributing to this aspect. Their advice is, number one, 20-20-20 rule, which means if your child is using near objects or near video game for 20 minutes, he should look away for 20 seconds, 20 feet away. When person is looking at the near objects, the eye muscles are turned in to focus the near object. It causes pressure on the eye and makes the eye longer, and that's the myopia. Now, if your child is already in glasses, make sure that you talk to the doctor how to prevent the progression of myopia. At this time, again, 20-20-20 rule, or there are some eye drops, very mild atropine eye drops that you can use at night to relax the muscles. Also, there are a type of contact lenses, multifocal, and glasses that are multifocal or bifocal that may help the progression of myopia. Not only we need to diagnose myopia, we also need to diagnose other causes of vision problems like astigmatism and hyperopia. Along with this, we also need to protect the eyes from the sunlight. So again, the children can use the UV filter or the big hat to protect the eyes from the sun. The other diseases that affect the children are crossing of the eyes or outward deviation of the eyes. So again, when the eyes are not aligned properly, the child is only using one eye at a time, and this can lead to the formation of amblyopia. More so it happens if the eyes are crossing. So it's important that either the pediatrician or the doctor make sure the eyes are aligned properly. The child is using both eyes simultaneously. Now, if the eyes are crossing, first step is to see if the child is over-focusing, and that happens mostly when the child is between the ages of 2 and 4 years of age. So sometime, if the child is over-focusing, the glasses would help. There is also a possibility the glass would help for a while, and the child will start crossing again. At that time, glasses will be checked again for new prescription, and if these glasses don't help, the surgery will be needed. There are other types of children who are crossing and the glasses will not help, and they will need surgical correction. Now, if the eyes are going out, most of the times, depending on the amount of deviation, the first step may be doing the exercise to make the muscles stronger so the eyes do not go out. If that does not help, after 3 months to 4 months of exercising the eyes, then surgical intervention will help. Again, depending on the age, when the child has ptosis and he is ready to go to school, the ptosis need to be corrected to avoid the blemish or the other children saying, oh, you do not see good, or you do not have a good eye appearance, and that need to be corrected before the child goes to school. I think these are the common conditions that need to be taken care of early on to prevent loss or developing lazy eye in one eye or both the eyes.
We give children a good start with their vision, and we've given them a great gift. Thank you so much, Dr. Fagoora. We'll see you next time.
Thank you.